moms, thank you for sending in your questions for me. So let's get right into it. The first question asked was, is it important to take prenatal genetic counseling? Now, prenatal genetic counseling is provided for all prospective parents, ideally before conception, to assess risks for any congenital disorders. The second question you asked was, should I get genetic testing done? Now, unless you're at a risk that your baby may suffer from birth defects, it is not mandatory. However, if you want to be sure, screening tests are usually done during the first and second trimester, and you can ask the doctor about it. The next question was, should I test for Down syndrome during pregnancy? Now, nowadays, gynecologists advise anyone who's pregnant and over the age of 35 to get themselves tested, because the major risk factor for developing Down syndrome is advancing maternal age. The fourth question you asked me was, I stress over my relationship with my spouse and what should I do? You need to make time for conversations. Share the excitement of the upcoming birth of your baby and plan the future together as a team. Understand and fulfill the emotional and physical needs of the other person. After all, he's an equal stakeholder here. The fifth question you asked me was how to build a stronger bond with your mother-in-law. Although this seems to be a tough one, it really isn't. Simply stated, you need to set boundaries which you discuss with your spouse and gently let your mother-in-law know that she is welcomed, but she is not the one going to be making the final decisions. You can use her years of experience to your advantage and ask for help when you need it. The next question you asked is, can I suggest any ways of being happy during pregnancy? There's so many ways, but a few of my favorites include reminding yourself to take each day as it counts. Try meditating or journaling to create that mindfulness. Pamper yourself as much as you want to and learn to delegate work. The next question you asked me was how to keep my baby healthy inside. Now remember ladies, a healthy body equals a healthier baby. So take your prenatal vitamins as prescribed by your doctor every day. Eat home cooked wholesome meals, regularly exercise, and stay away from hot tubs and saunas as they increase the risk of increasing your body temperature and catching an infection. The next question you asked me was, how should I avoid comparing myself to other mothers? We need to be grateful. Recognize and appreciate everything that you are doing instead of what you are not able to do. And follow any social media accounts that are not making you happy, and make a list every morning of what you want to achieve and set your mind to it. The next question you asked me was, can I suggest any tips to prevent depression? I would suggest being aware that there are certain risk factors which include having a history of depression, experiencing abuse, unplanned or unwanted pregnancies, any complications during pregnancies, and other risk factors like stressful life events, low socioeconomic status, being sick, or a teen parenthood can cause depression, and you can seek counseling to deal with it effectively. The last question was, is it normal to have suicidal thoughts during pregnancy? Pregnancy and postpartum period are very vulnerable times for every woman, especially with those who have a history of depression and other mental health conditions. Severe cases may include thoughts of self-harm or harming others. Please remember that if you are seriously concerned and are worried about your mental health, do consult a medical professional immediately. I hope my answers have cleared some of your doubts, and I'll be happy to elaborate if you leave a comment below. Keep sending us your videos and participating in our weekly giveaways and contests, and I'm going to meet you next time in my other video for Making Motherhood Joyful community. Bye.